range of experience in this audience group. I do want to address the issue around the distress component. I know that both Darlene and Aiden are going to talk a lot about this. I think that the distress criterion is really difficult. Like I said, I think even the whole entire DSM criteria for prepubertal children is problematic. And I also recognize and know that there are many young people who are socially transitioned and they're doing just fine and they don't experience that distress. We're going to talk about that a little bit more as we move into adolescence. All right. And by the way, welcome to all the parents of trans youth that are here learning all this stuff to help their kid. That's so important. So what do a lot of parents, what are their concerns, right? Like what I really love is that in 2024, there are many, many parents who come in who have absolute delight at raising a child who's trans or gender expansive or gender diverse or however they define it. And that is a huge change and one that I'm so grateful for. That is my experience in California as a practitioner. It might not be the same everywhere. I used to hear a lot of this. I still hear this sometimes. What did we do wrong? Right? Why is my kid like this? How can they know their gender at this young of an age? What if we're wrong to support our kid? What will people think of us? Like, what are my parents going to think of me if I support my kid? Who will love my child? This is a particularly painful one. And will this destroy our marriage or our partnership? And so I hear these things a lot, and I'm hoping that we can move the needle away from gender dysphoria and more toward gender euphoria when we're talking about these young people. And then this is another one that I hear a lot is what will our religious community think or do? And this is very hard when somebody is very involved in their religious community. Are they going to be accepted? Are they going to have to choose between their child and their religious affiliation or community? And that's incredibly challenging. So you probably all know, but I think this is well worth a refresher, especially given some recent things that have happened in the legislature. So there are really three approaches to gender non-conforming children or gender diverse children. I use non-conforming because I feel like the onus of conforming goes on to the folks who feel like there's an importance in conforming. I'm a non-conforming adult in that way, in a lot of ways. And so I want to preface it with saying that this first reparative or conversion therapy, this is actually case number 3, it's labeled wrong. I saw a 15-year-old who's registered female at birth. This kiddo was fostered and then adopted at age 3 into a very religious family. By 5 or 6, this kid knew that he was a boy. And it started to experience chest development and menarche, which is the first episode of menstrual bleeding at 9 years old, which is fairly young. This kid came out at 12 years old and then was at home, and there was actually a coming out ministry that came to the house to try and talk this kid out of his gender. I met him at age 15, and he was still carrying significant trauma about that. It was not helpful in his emotional or mental health state, and it also did not make him not trans. Conversion therapy has been demonstrated over and over to be extremely harmful to individuals who go through it. Young people who experience conversion therapy are 8 times as likely to have attempted suicide, 6 times as likely to report high levels of depression, and 3 times as likely to use illegal drugs. Conversion therapy was originally started related to anti-gay and anti-lesbian and anti-bisexual space of trying to change somebody's sexuality, and it is also still used today to try and change people's gender. It's punitive, and so it relies on behavior modification that ranges from, taking away things that people love to, recommending that parents like ice their kids out. And early in the mid-century, the 1950s, it also included even like shock therapy. A lot of times young people will get multiple referrals to psychiatrists so that they can be medicated. There's an inappropriate and extraordinary use of psychotropic medications to reduce symptoms of gender dysphoria. The kiddo who was raised on the base and at 5 years old that I showed you was taking 15 pills a day, all psychotropic medications at age 5. Can gender identity be changed? By 5 or 6 years, children begin to be influenced by social pressure to conform, and they may adjust their behavior to make their life easier. But what drives gender typical and gender nonconforming traits cannot be changed through the influence of parents, teachers, coaches, or therapists. You can change someone's behavior, but you cannot change their internal sense of their gender. Watchful waiting is probably the most, we're going to see a big lean on this for folks who know about the Cass report. This is going to be the way that everybody is going to try and move. This involves redirecting activities of a young person. This involves behavior modification that can result in feelings of shame and is primarily created to attend to the needs of the parents or caregivers. And that is a lot of times people will say, I let my kid wear whatever they want at home, but they can't do that at school. What do we mean by gender affirmation? Boy, this language has gotten really politicized. But what we mean by that is an interpersonal, interactive process whereby a person receives social recognition and support for their gender identity and expression. And this can be across legal domains, personal domains, educational domains, religious domains. It really takes a stance that follows the child. This was a case that I was part of, and part of this was a kid who's registered male at birth, identified as a girl. The court from another state, the court had ruled that this kid could have no things that are stereotypically affiliated with girls. No dresses, no dolls, no nothing, no purple and pink pencils, nothing, no apps, games, etc. And so this kid called that the rule. And I asked her to draw a picture of herself now and a picture of herself after the rule was lifted, if that rule ever did get lifted. And this is what she drew. And again, this is not my area of expertise, but I do know that when kids draw themselves without hands, it represents sort of a lack of control or a lack of agency. So we talked about this, what gender affirmation is. It follows the child. It may or may not involve a social transition. Just 2 parental pathways. If a child is expressing atypical gender interests and a parent suppresses that, you're going to have an anxious and angry child that is at risk for negative health outcomes, both physical and emotional. If a child expresses atypical gender interests and the parent explores that interest with them, then you usually have a more anxious parent, but you have a happier child. And that child is more likely to be well adjusted. Let's talk about social transition. I'm going to briefly touch on this. I know that Darlene talks a lot about this, but a social transition involves the outward expression of an internal gender. That outward expression is aligned. It means living in the asserted gender, or whatever that means to the child. It may mean changing your clothes, your hairstyle, maybe your name, maybe your pronouns, and all of these things are reversible. This is really important to understand this. They're all reversible. This kid, after the mom took this kid home from the 5-year physical, She transitioned. She's so much happier now. She's actually much older than this. She's a thriving young woman in college. And you can just see in the smile and the happiness what a difference it made for this young person. I've always wondered what the problem is with giving somebody clothing that feels more comfortable for them. Shout out to our trans boys over there with the beard and the mustache. I think there has been an increasing body of literature that demonstrates that social transition for kids who desire and need it really improves their mental health. And so I strongly encourage, and I can certainly add in a reference list the data that has demonstrated this. Unfortunately, there has been a trope that says social transition should happen under the care of a clinician, which I think is not really necessary at all. There are many patients that I see that have already socially transitioned in the context of their home and their family, and they did not need a clinician to guide them through that. Okay, my time for this morning is up. You get a 10-minute break, and then you have the joy of hearing Darlene Tando talk about additional things at 9:30. I will be back tomorrow morning to wrap this section up and talk about the differing trajectories of trans young people. Thanks so much for being